Hello, thank you for coming today. We're here today on Treaty 6 territory, and I also recognize the Métis people of Alberta who have a deep connection with this land. I'm joined by my colleague, Shannon Phillips, who is the MLA for Lethbridge West and our caucus's finance critic. We are here to demand accountability and transparency from the UCP to address the growing crisis in healthcare. The Health Minister, Jason Copping, provides a weekly briefing about COVID-19 where he takes very few questions from the media and continually makes an argument that the health system is operating near normal. There is nothing normal about the crisis that we are experiencing. And Jason Copping must address that crisis when he is at his 3:30 briefing today. AHS announced today that both the Stettler Emergency Department and Sylvan Lake Ambulatory Care Service will be closed because of a shortage of doctors. Unfortunately, situations like this are becoming much too frequent under the UCP. There are currently 20 communities with a fully or partially closed hospital, putting more pressure on surrounding communities and urban hospitals. Lineups outside hospitals are becoming too common as emergency wait times continue to increase. Indeed, last week I shared details of how it's taking longer for patients to be seen and discharged in every hospital in Calgary. And we know this is also the case in Edmonton. The Red Deer Hospital had 14 ambulances lined up outside the emergency department just a few weeks ago. And they are currently diverting their surgeries to other locations, which is putting pressure on surgeries to be canceled and diverted across the province. Indeed, an Albertan named Donna had her open heart surgery canceled just a week ago in Calgary, 5 minutes before the scheduled time, because there were not enough resources to care for her post-operation. She told us this is not the staff's fault, but that she was very disappointed in the health minister for how he continues to try to present the current situation in healthcare as being normal. Situations like this must not be normalized. So at his public briefing today and all following public briefings, the health minister must start providing more detailed information about the current crisis in healthcare. The healthcare crisis has expanded beyond COVID-19. The UCP must transparently tell Albertans what is happening and what will be done to address it. First, we're calling on Minister Copping to provide weekly reporting on doctor recruitment and departures. We know that doctors are leaving Alberta at record rates. The number of doctors accepting new patients through primary care networks has been cut in half in the last 2 years. When people do not have a family doctor, they become more reliant on emergency rooms, which are clearly not able to meet the demand right now. Second, Minister Copping must provide weekly updates on EMS wait times. Albertans no longer have certainty that an ambulance is able to arrive when they need one. The UCP must tell Albertans how bad the situation is and the exact and concrete steps they intend to take to fix it. Third, the UCP must report on canceled and diverted surgeries across the province. The health minister says we're operating near pre-pandemic levels, but has provided no detail on how diverted surgeries from Red Deer are impacting other communities and where other surgeries are being canceled and diverted. And finally, the interim CEO of Alberta Health Services must be present to provide technical information at all weekly briefings. The UCP chose to fire Dr. Verna Yu, and in the wake of that disastrous decision, the crisis in healthcare has only gotten worse. AHS lost its leadership at the worst time. The Chief Medical Officer of Health has provided Albertans with information about population health related to the pandemic, but Albertans need more information about the details of how the health system is working on the ground level. We are in a healthcare crisis, and the UCP must tell Albertans honestly what is happening and how they are going to work to address it. We believe that providing frequent updates on doctor recruitment, ambulance wait times, and canceled and diverted surgeries is an important and essential first step. I will now turn things over to Shannon.
Well, thank you, David. My community of Lethbridge has seen this crisis firsthand, and it is being felt across southern Alberta. We have 43,000 residents in my community who do not have access to a family doctor. This, of course, puts more strain on the emergency department. Shortages of doctors in other communities, such as Medicine Hat, puts more pressure on Lethbridge. I have been raising the alarm, calling on the UCP to present a plan for more than 6 months. Actually, it's been pretty much a year now, but they have done nothing. Last week, I attended an information session organized by AHS where we had the city, the Chamber of Commerce, we had economic development, we had the college, local school boards, all there to discuss efforts to attract doctors. There were a number of organizations there to provide suggestions. We had volunteers from the hospital providing suggestions even. It was described that day as a community problem. But the fact of the matter is that there is a key member that was not at present. They were the only member that wasn't present, which was the Ministry of Health. The one organization that can provide the resources, an action plan, metrics, interim benchmarks, appropriate data reporting, goals, money, that organization was the one that was absent. There is no leadership coming from the Ministry of Health, leaving the community to flail in their absence. Now, our community is doing everything we can to fix this crisis in healthcare, but we cannot be successful without the one organization who has the power to fix it, which is the provincial government. Because not only are the UCP absent from this crisis, they are actively making it worse with each passing week and month. They continue to wage war on healthcare workers, including doctors, nurses, and allied professionals. And now, while healthcare workers sound the alarm about the current crisis, their concerns are downplayed by the UCP, they're contradicted and bullied by the UCP, and folks are burned out. They are not feeling the respect that they need to feel from their provincial government. The pandemic was a traumatic event for healthcare workers, and it was made worse by the UCP's mishandling of COVID-19. Healthcare workers should not have to do this alone. They must have a government that supports them. It is clear that the UCP do not, but an NDP government would. The UCP have spent so much time focusing on their internal power struggles that they have completely neglected this crisis and abandoned the healthcare heroes serving Albertans through it. When Jason Copping speaks today, he must speak directly on what specifically he is doing to address this crisis in healthcare. Thank you, and we will now take your questions.
All right, we'll now turn it over to questions. We'll start in the room, but if you are on the phone or Zoom, please use *9 or the raise hand function.
UCP sent out or the government sent out a release today saying they're adding 100 new EMS positions in the province. Is this a good first step? Do you see a positive in this? Is it far enough? What do you make of this?
So having taken a look at the release and reached out to speak to some of the folks who are working frontline in the field, I'm not seeing anything new in this announcement today. This appears to simply be a re-announcement of previous initiatives and previous funding that the UCP has put forward. So I'm not impressed. Really what we need to see, I think, is a couple weeks ago, we stood with Mike Parker, the president of the HSA in Alberta, speaking on behalf of paramedics, and he made it quite clear what we need to see, that we need to be making sure we get every single paramedic off shift on time, that we should be offering every paramedic that is currently working casual, permanent, full-time positions with benefits, and that we need to ramp up services and resources to address a worsening drug poisoning crisis. So what we see the government doing here today is maybe moving on hiring some of those casuals over into full-time, but we don't have the data on that. So I would, that'd be a great question for the minister at his update today. Where specifically are they drawing these individuals from? Are these new hires? Are these folks moving from casual to full-time? Where are they being assigned? We need to see specifics, because we know this is a government that likes to play with numbers to try to hide the facts on the ground.
Part of this is that they say they're extending 70 temporary positions. I mean, are temporary positions the long-term solution?
Mike Parker was clear, speaking on behalf of paramedics. We don't need more casual, temporary paramedics. It is clear the need is there. We see it in the wait times. We see it in the pressures. We are hearing it from the folks on the front line themselves. This government doesn't need more casual, temporary employees. We need more full-time paramedics treated with respect, paid full-time with benefits. That is the action we need to see from this government, not this sort of patchwork that we're seeing from him here.
Yep. All right, we'll now go over to the phones and the Zoom. If you have a question on the phone, please press *9 and the raise hand function on the Zoom. All right, seeing no more questions, I will conclude our press conference for today. Thank you for attending, everyone.
Thank you.
Thanks, guys.
Thank you so much for watching, and to learn more, check out albertasfuture.ca.